This is a great time. My name is Sandy Resmer, and I'm a TA specialist, and I'm going to be facilitating this group, and I'm going to turn it over to Lana Nenide.
Yes.
I hope I pronounced your name correctly. I've been practicing.
Thank you.
And Lana is from Wisconsin, and I will let her take it from here.
Thank you so much. Thank you for this opportunity. I really appreciate having a chance to share a little bit of our story in the state of Wisconsin. As Sandy said, my name is Lana, and I work for the Wisconsin Alliance for Infant Mental Health. So we're a statewide nonprofit. We are your association for professionals across systems and disciplines who work to support babies and young children and their families. So I wanted to share a story of how we can use different approaches with the common goal in mind, and that goal is to support infant and early childhood mental health. So the two approaches that I would like to highlight for you, and you might be very familiar with those approaches. One is infant and early childhood mental health consultation. That's something that both Jamie and Allison talked about. And the other one is the pyramid model. So I'm sorry, I don't see your faces, so I don't know if this is a familiar framework or not familiar framework. So I will just briefly, very briefly mention that it's a framework that supports healthy social and emotional development. And as Jamie pointed out, when we define infant and early childhood mental health, we really think about healthy social and emotional development that in early childhood is only possible in the context of healthy relationships. And so the pyramid model is this tiered approach on how caregivers can support healthy social and emotional development and also address challenging behaviors in natural settings. So that's the pyramid model. It's based on the effective workforce, and then it includes several tiers. And if you think about the public health approach to well-being, that's the same kind of idea, that there are layers that are exactly relevant to everybody. They're universal layers, and those are the blue or light gray layers. Then there are targeted layers, and they're relevant to about 20% of children who really would benefit and who do benefit from direct instruction and experience around regulating emotions and learning about how to share and how to make friends. And then on the very top of the pyramid, we have intensive interventions. And that's, when I say intensive interventions, we really mean intensive on behalf of adults, not on behalf of children. And so those are careful strategies that are done by thoughtful people. And if everything is in place, we shouldn't have way too many children on the top of the pyramid, because we should be catching everybody early on and with these universal and targeted supports. So in Wisconsin, am I moving the slides? And can this, do you see the new slide now, Sandy?
Yes, we do.
Thank you. Perfect. So in Wisconsin, we started the state implementation of the pyramid model in 2009. So we're very experienced with that. We've thought about it. We've talked to a lot of community members. We've talked to a lot of programs. We have been coordinating. My agency have had the contract to coordinate this framework. We have state directors and we have regional leads. So Wisconsin is divided into 5 large regions, and every region has a lead that connects to local communities and local programs. We now have 66 programs and 173 sites that are implementing pyramid model with fidelity, which means that they have program leadership team, they have a coach, they use the data-based decision-making system. And this is what we know, and this is really exciting. We know with certainty, because we collect data, that in our pyramid model programs, and this is this is relatively fresh data. We published it in our 2022 impact report. In our pyramid model programs, the expulsion rate is significantly lower than in just regular childcare programs, and it's 13 times lower. So it's something very significant. It's something that we're proud about, and it shows the really the impact and wonderful outcomes of implementing this model with fidelity. There's also a link should you want to see the website and get the information, and it should be in your notes catcher, which I think is a brilliant idea. In this year, in January 1st, we finally were allocated funds to build a system for consultation. So in Wisconsin, this is a relatively new system. We've had consultation here and there. Of course, it's available through Head Start because it's mandated, but the way it's envisioned, the way it was described to you by Jamie, and the way we really think about it, we've started January 1st. So it's August, which means we are in month 8 of developing a consultation system. And we use exactly the same framework as the Center of Excellence. We use exactly that idea of improving and enhancing capacities of adults so that they can enhance and improve skills of very young children. In Wisconsin, our consultation program is called Healthy Minds, Healthy Children. And right now, the way funding is allocated in our state is we're focusing right now on early care and education system. This is the focus for this year and next. But the way we're building everything, the way we have envisioned consultation in Wisconsin is that it really will be universal. So any professional who works in any system that serves infants and young children and families, whether it's home visitor, child welfare, Part C provider, a pediatrician, and of course, early care and education provider, should have access to a consultant. We're building up to that, again, with our initial focus on early care and education. So the question then becomes, how does this work? How does it work when you have a strong system for pyramid model, for social emotional support, and you're building up a system for consultation? And so for us, it's very important in who does what, and we're trying to be very careful and very thoughtful about distinguishing the roles and responsibilities. I truly do believe that it's important so that it's a collaborative relationship, that it's an integrated approach, as opposed to competing over resources, competing over who gets to go to a center. And we definitely don't want anybody to feel that their jobs are being taken away. And I know that sometimes that is the fear that, oh, they come and they sort of take away our positions. We don't want that. So we're very clear in distinguishing who can do what. And so I have my last slide here is to really just clarify on the roles and responsibilities. And for pyramid model coaches, so those who come into the programs and support the programs in implementing pyramid model, their focus is really on implementing this particular framework with fidelity that we know already leads to increased and enhanced social and emotional skill. What they do is they use practice-based coaching strategies. They use their tools, TPOTs and TPTOs. They use data-based decision-making. They do family engagement support. And they're early childhood professionals, right, with training and experience in pyramid model. And then mental health consultants in Wisconsin, we're very careful and very, very clear that our consultants have to be master level licensed or license eligible professionals, that they should have expertise in infant and early childhood mental health. And in Wisconsin, we will be providing consultation on 4 different levels: on the child level, on the classroom level, classroom or home level, if it's a family childcare, on a programmatic level, and also on the community level. What can we do for community to connect family with resources, to reduce isolation and promote integration? So again, for us, integration and collaboration, so it's not either or, it's both and, is very important, and we distinguish it in roles and in education and in preparation of our consultants and our pyramid model coaches. So that is my last slide. So I'm going to stop screen sharing, and maybe we could all have a conversation, and maybe even people would be okay turning on their cameras, and so that we can see one another. That would be lovely.
Ah, yes, we have brave souls.
Thank you, thank you. It just makes everything a little bit less abstract, because just looking at the squares with names, it's not quite.
Okay, and I think if anybody has initial questions for Lana, you can take yourself off mute, and we would love to hear your comments, questions.
I have a question about your pyramid model coaches.
Yes.
The scope of work that I saw, how do they handle all of that work?
Yeah,
Or
so
is it feasible for them?
This is a really good question. So sites that come on board to implement pyramid model really have to think carefully if this is something that they can take on. Mm-hmm. And what we do, Teresa, is we have sort of two roles. One role is an internal coach, so somebody who is within the program who should be released from some of their duties because they will be doing some of the coaching. Okay. So we're very clear that we got to have administrators support. We got to have some infrastructure, right? And right now for the pyramid model, we really are really successful in implementing in center-based care, in sort of collaborative childcare. We haven't quite figured out yet how to do it well in family childcare, right? Like how are you going to wear all these hats? Yeah. But what we do have is for programs that are saying, yep, we can do it. We can release somebody. It could be an instruction support person. It could be an assistant director. But again, that means that you have extra people in your program, right? Okay. And we also all know what's happening in childcare right now, right? So everybody's covering the classrooms, right? So we also, every program that says that they're ready, and we look at their readiness, and we invite them to join the cohort of implementing sites, gets assigned an external coach. And okay. That's somebody outside the program. And that's somebody who could sit and work with the internal coach, with their director, and hold on these pieces when sometimes they fall apart or sometimes they become confusing. It's an extra set of arms and hands, especially important in the first year of the implementation.
Okay. Yeah. So have you seen so far that it's working well?
It's working well for sites that are ready to implement. And
okay. They even as far as the family support piece?
Yes.
Okay.
Yes. Yeah.
Okay.
Anyone else have a question? Lana, I have a question. What were your challenges?
With what?
With developing this, kind of like starting it, the process.
So I will tell you, with the pyramid model a long time ago, so 2009, right? It was challenging because it was a new initiative. It's always, there is this tension between sort of being the new training initiative du jour that everybody wants to do versus sort of, because when resources are limited, then sometimes there is additional tension and a little bit of a territorial kind of stance. So it was a little bit hard to prove, to get buy-in from programs, right? Why should we do that? Does it really make sense? And then generally, often there could be a couple of misconceptions. For example, sometimes people might believe that when we talk about a pyramid model, we really mean this particular training, right? And we always wanted and tried to explain to our audiences that really it's not a training. There's a training component, but this is way beyond that. It's a way that you think about things. It's a framework. It's a way of intervening and adjusting and promoting and supporting. So that was happening. And then at some point, and I think it's true for probably almost everybody here, and I don't know exactly which states we have represented, but at some point, there was this pushback against social and emotional learning. There still is. And I think it's happening around our country, and it's quite unfortunate. But it's happening in Wisconsin as well. And so we had to be very thoughtful and careful about how do we communicate about the pyramid model. What does it mean? How do we not alienate anybody just because we're using the terminology that became sort of, for some reason, slightly misguided and misinterpreted? As for the consultation, we've known for a long time that there's a high need, that mental health issues are real, that they are present in very young children. And so to put that on the agenda and to find the funding for that program to exist, that took quite a bit of time to explain to our policymakers and state funders that this is the system that deserves to exist. Was a lot of legwork, a lot of advocacy to again put that system on the menu. And so, and now the challenge honestly is sustainability. And I think in early childhood we're often dealing with these, here's the funding, here's the time limit, and then I almost feels like you started the funding and it's like the timer is going on, right? The timer is on and you're like, you're running around, you're trying to do the work, and at the same time, you're trying to ensure that the work you're doing right now will have sustainability and will live a long time, right? So, so with consultation right now, our effort is both the building and piloting and sustaining this modality of support.
Thank you. I think with a lot of the things that we do, we are kind of doing two roadways. We're developing, and while we're developing, we're thinking about sustainability and what we need to do for that. Oh, I see. Well, the pictures keep moving around, and Pauline, you've gone from the top to the bottom. So would you like to ask a question?
Yes, just a comment. I'm glad she brought up sustainability. I'm from the island of Guam, and we have utilized the pyramid model training ever since, as we say, when it was CEFL, the Center for Social Emotional Foundations and Early Learning. And we've just recently made the connection again with Dr. Corso to bring back a lot of the initial cohorts we trained, we've lost through COVID, etc. So one certain group, a Micronesian group of Chuukese families, continue to do the training, doing it in their language. So we're really happy that we've been able to sustain that. But as far as, Guam Early Intervention and all there's all new players. So we have to, so that's what our PDG is doing, is bringing back that pyramid model training. But sustainability, just keeping those balls in the air all the time is always the challenge. So that would be my comment.
Yeah.
So
Thank you.
Thank you for sharing.
Lana, I just wanted to ask really quick, are you guys billing Medicaid for any of these services?
Not for pyramid model, it's state funded. And for the consultation, not quite yet. We're sort of tapping gently into what is possible. And again, not yet. It's a little bit challenging, right? Because the way we think of consultation, we want to be able to offer it preventatively. And we also want to be able to offer it on multiple levels, including classroom and program level. And once you remove it from an individual child, then it becomes a little tricky. So we haven't yet explored how Medicaid could become one of the funding sources, but it's sort of definitely on our radar. How about in Georgia?
Yes, we are trying to figure that out. We are very new in the consultation world, so we
Yes.
have pyramid model coaches and have had for several years.
Yes.
But we are adding the new level of supportive consultation. We're doing a pilot with ARPA funding right
Yes.
now, and there's been a lot of challenges, a lot of barriers. So we're kind of working through it. But one of our long-term strategies is to really define what the service components of consultation are, so
Yes.
that if we can't build consultation as a whole model, that we can build components of that. We have been very successful in Georgia at really using existing billing codes to bill
Yes.
for the early childhood mental health services. So we are starting on the prevention end and looking at how we can bill for consultation, at least for portions of it. So just interested in any states also looking at that, because also Medicaid is so different in every state, but also I think the approach or the strategies of how we look at it can be useful to share.
Yeah, no, thank you so much, Laura. And I imagine that you probably know about 0 to 3 resources on Medicaid, right? And they have a cohort of states that are going through. Yes,
we're in it.
You're connected to that. That's great. Yeah.
Yes.
Any other questions? Lana, we had a request for your email.
Oh, yes, I'll
in
put it
in the chat, and I realized I did not have your email.
I got
So
that.
if you could share that.
Yep.
And while Lana is doing that, do we have any other questions?
This is Betsy Shealy. I'm from New York State. Lana, it's nice to hear Pyramid associated and aligned like this. So at the Council of Children and Families in New York State, we do use Pyramid in conjunction, not specifically to address infant mental health, but we do have a very elaborate, the PID system came from us. And so we use the data in a number of ways. We have a separate office of Children and Family Services in New York State, and they control a lot of the childcare money. And so our role is that we try and align ourselves with them. And as they are doing the workforce initiatives, that we introduce Pyramid and say, this is a wonderful workforce initiative. And we try and get in their funding that way. And we show them the data that can be drawn from that for expulsion and suspensions, because it's part of the racial justice driver here in New York State. So our governor has just put a lot of money into our state education department to address those things. And so we're trying to make the correlation that this is a scalable system, that not only does it work with the infant and early childhood mental health, but that it can be scaled for your K through 12.
Absolutely.
And that it reduces behaviors and that your suspensions go down, and then, therefore they're in a learning environment. So it really is, Pyramid's a great systems work. And we are using the PDG funds to drive the Pyramid work, to do the systems work in New York State. So I love what you're saying. I'm fully in. I bought it all.
That's brilliant. Yeah. And I really do believe that Pyramid is an incredibly strong framework. It makes sense. It works right in multiple natural settings. And as you said, it's easily generalizable onto the school years. So that's great. And I also believe that when we think about consultation, when we think about bringing in consultants, I do believe that when programs are already implementing pyramid model, they're at a different degree of readiness for consultants, meaning that consultants often don't have to go back and sort of figure out, okay, what is this case about? Because many things are already in place, and it really is becoming more efficient, which is translates into less costly to our funders when we have both of these frameworks in place. Why am I saying that? Because I believe it's essential that consultants, in fact, are master's prepared, licensed professionals. Pyramid model coaches don't need to be. So it is a lot less expensive to have somebody who has strong developmental background, strong understanding of good practices, to go into a classroom and figure out why is this chaos, what's happening. And oftentimes many issues are resolved by figuring out, together with the teacher or with the program, the universal practices. And once those are in place, we have a lot fewer kids who need this intensive support. So what I'm saying is, I really do believe that combining the two is just so smart, because it becomes less costly and more efficient.
Any other questions for Lana? Would anyone like to share information regarding the work that your state is doing? I know we've heard from some. Would anybody like to share?
North Carolina has had a pyramid model program since 2005 that is very well entrenched in our CCDF funding system. We have now 40 pyramid model specialists, behavior specialists spread across the state to serve some 7,500 licensed child care centers in the state. So we still don't have enough to serve all the classrooms. And ours is a technical assistance coaching and consultation type of piece or project. We're sort of like Georgia. We do parts and pieces of it is more coaching than anything else, but we do parts and pieces of the other as well. We cannot charge ours out to mental health because we're fully funded through CCDF.
Yes.
And I don't anticipate that changing in the near future, but I wish I had a crystal ball, don't y'all?
Oh, for sure. I'm curious if in any of the states that are represented here, do we have a state where pyramid and or consultation are connected to your quality rating and improvement system in the childcare world?
I wish. I've been begging for that for years because it would improve the uptake within the childcare providers if there were some driver behind what we do.
I just feel that there are so many systemic, well, maybe not so many, but there are a number of systemic pieces that would help with, as you said, the uptake, and also with some credibility, with some elevation of, it becomes not just as something that we've been doing for a long time. Even when you have data are great. I mean, you need to have data and stories, but I think it's sometimes in these systemic pieces when things really, when talking about sustainability, talking about longevity of something. So I'm just curious. So no connection here. Okay.
Not in North Carolina. Anybody else?
So I'm North Carolina with Wake Smart Start. And so my title is Social Emotional Quality Enhancement Specialist. So actually going in and modeling and coaching to the teachers, where I don't work directly with the kids, but I will be coaching with the teachers, teaching the pyramid model and just kind of modeling different strategies and interventions for them with kids that have the social emotional behavior issues going on in the pre-K classroom.
That's great.
So we have about 3 more minutes. Any final thoughts from our group? And I guess I have like one last question. You know, what additional information or support would you want on this topic?
Utah's brand new to the pyramid model as far as fast implementation. We're just babies with it, but we're excited about it. And so the biggest hurdle we're having is how to get that initial buy-in, that kind of awkward phase you talked about. That's our biggest sticking point, is how to get the buy-in when they realize it's not just training, that it is a whole foundational framework. Because we really believe, I mean, we're implementing it because we have, you know, seen all the great work you guys have done and appreciate that. So any feedback or thoughts about how to get buy-in is what would be helpful for us moving forward on this topic.
Yeah, we've been really thinking about what does it mean to get buy-in. I'm putting a specific link to our homepage for the pyramid model. We are working on some little videos. So we sent videographers to our child care centers to get testimonials and little videos from Wisconsin programs, so that it's not us saying this is wonderful and it's working, but it's the teachers and the coaches and parents, right? Most importantly, parents. And so we're trying to collect some of this. So we have good data, but again, in the time when somehow social and emotional became almost controversial, it's good to remind people that, as Allison was saying, right, it's a protective factor against abuse. It's a protective factor against trauma. It's what we all want for our children and for our adults. I was just at the orientation for my freshman to be, and one of the slides showed that what they're hoping their freshmen, their incoming class to have is ability to manage their emotions. I mean, these are 18, 20, 18, 19, 20-year-olds, right? It never goes away. It's a lifelong goal. But the foundation of it is laid in the very early childhood. And if it's not laid, it's so, that it's so much harder, right? Then you have to fix and you have to do interventions. Then you get a reputation of somebody who is dysregulated and disruptive. So I think those kinds of stories, and again, I think once you talk about this, it becomes very clear. People understand it and respond well to it. But sometimes it's sort of like, I don't want to hear that. So I think stories, data, and video, whenever possible, that seems to help.
Exactly. I think the most important is the positive solutions for families.
Yes.
And doing the training with the families, getting to the grassroots of the problem. The bad news is the families or the parents are the problem, but the good news is they're also the solution, right? How they interact with their children, and finding those teachable moments, and not saying no, but to say things positively, not running, but
reframing and restating.
Tell them what to do, walk, right? Just all those techniques that are very important for families to know, and just getting so regarding coaching and everyone, but getting the word to the families.
I love that. And then it creates consistency, right? So if you have that, if you're trying to implement this framework in a classroom, in a setting, in a program, and you're also bringing families on board through solutions for families, then there's this beautiful consistency and common language. And then this is also very trauma informed, right? Because it creates continuity from what's happening at home, what kind of language is used, what kind of, if parents use Tucker and they use Tucker the turtle, where they go into their shells and breathe in the classroom, that kind of recognition creates a sense of safety and familiarity, and children respond. It's like a familiar tune, right? Like it's, oh yeah, I know that. It's a good one. I wanna do it more. So
Right.
And Mandy, are you talking about buy-in for parents? Or are you talking about buy-in for like your partners? I'm just curious.
A little bit of both.
Yeah, I will say, I think they really covered in terms of your buy-in for your parents and your program, but in terms of your partners, you try and use the language that they use. So OMH, it's about infant mental health. And when you're talking to state ed, you're talking about expulsion, and expulsion. And when you're talking to, the State Department, it's about racial equity and justice. So it's taking the keywords that you're looking for buy-in around and really wrapping that data in those words, so you have a language to express, and then they understand what you're talking about and how it's applicable to them. And that is how we find good buy-in across the state.
thank you. That's very
Thank you,
clear.
all of you. I appreciate it.
We are closing in 5 seconds.
Okay.
Perfect timing. Thank you all for participating.